Hi everyone. Welcome to your pharmacy career planning course. My name is Sarah Davis and I'm going to be your instructor for the next 10 weeks. Um, we're going to be covering several different chapters in this particular textbook. The first chapter that you're going to be covering in week 1 is actually chapter 2. So this week we're going to look at Introduction to Long-Term Care. Basically what we're going to do over the next several weeks is look at all of the different places that you might be utilizing your skills in as a pharmacy technician. And long-term care is just one of those places where you might be utilizing those skills. Most of us think of the retail setting, but there are a lot of other settings that we can work in as a pharmacy technician. So when we think about long-term care, most of us are probably thinking about nursing homes. A lot of times that's kind of the go-to thing that we think about. But really, when we talk about long-term care, it's just any type of care that's provided for an individual over an extended period of time. So that might be health care, but it could also be personal care, social services, housing services, and it really doesn't matter the age of the person. So it's anybody who has some sort of chronic or long-term health problem that limits their daily activity. So obviously the elderly fall into this bucket, but in addition, it might be people who are victims of accidents, children with birth defects, mentally disabled, physically disabled, anyone with a chronic illness would fall into this type of setting. So some of the characteristics of long-term care is that they're there to support the patient. So they're not necessarily there to cure the patient like you would think of in an acute care setting. So let's say we're talking about a hospital. You go in, you have a knee replacement, we're going to get you back up and running. However, in a long-term care setting, it's just to support that patient and to help them in their daily lives. So it is less expensive than being in a hospital for those types of things. So that is obviously one of the many reasons that patients turn to long-term care. There's lots of sources for funding for long-term care. Most of us are going to probably think of those federal programs such as Medicaid and Medicare, but there are also private insurances that can help cover this, as well as, out of pocket, just, paying for it as an individual. Some of the different types of settings are included here: subacute, nursing facilities, psychiatric hospitals and specialty hospitals, and correctional facilities. And we'll take a little bit of a deeper dive into what each of those means. So the first is the subacute care. This is, it's kind of an in-between phase for subacute. It's somewhere in between a hospital and a nursing home. A lot of times they don't necessarily need that intensive hospital stay, but they do still need care. So the idea here behind this type of facility is to improve the patient and to get them moved into less intensive type of care. So it may be almost kind of a rehab situation for some of these folks. Then we have nursing facilities. So again, this is between acute care and the community-based long-term care. They have complicated medical problems. It's got a lot lower ratio of staff to patient than regular facilities. So this might be, not only do they have something that they're recovering from, but they also have other things, like maybe they have diabetes and high blood pressure and all of these other things going on at the same time. Then we have psychiatric and specialty hospitals. These are for patients who have just what it sounds like, psychiatric conditions. We have correctional facilities as well that fall into long-term care because obviously if someone is in jail or prison, they are there for a longer period of time and they still require medical care. So there are different types of medical attention available in these facilities depending on the type. County and local jails are short-term, so they may not have the same level of care as federal and state. Now, when we talk about a community setting, this is where we provide long-term care in a home type of setting. So this is where you're going to get help with everything from bathing, dressing, eating, all of those types of things. So when we think of community setting, these are some of the things that fall into that bucket. Assisted living facilities, retirement housing, senior centers, adult foster care, hospice, subsidized apartment cares. All of those things fall into what we consider community-based long-term care. We're going to get into a little bit of some differences between some of that. What's the difference between assisted living versus a nursing facility? So make sure that you're aware of those. The idea is that when we talk about these community-based places, they're supposed to have more of a home-like setting. We're trying to make the patient feel as much at home as possible and focus on their wellness rather than what's wrong with them. They're going to talk a lot about the details behind each of these different types of community-based facilities. And then they're also going to talk about some of the conditions that face the elderly that are in this population. So when we talk about the elderly population, this is kind of the groups that they fall into. 65 to 74. These are a lot of times these are the folks that just don't want to have to deal with maybe having a house or an apartment to take care of. They just want somebody else to take care of some of that stuff. 75 to 84, they're still pretty healthy, able to live without much of an assistance, but maybe they do have some more chronic conditions. And then once you get to the 85 years and older, that's when they require more of a long-term type of care. So again, they're going to talk about some of the drug-related problems in these elderly folks, and how you as a pharmacy technician can play a role in that. So if at any time you have any questions over this week's material, please make sure that you reach out to me, and have a great week.